Hello, my name is Chan Parmachan. Today we'll be doing the healthcare visit and screening. This community health session presentation is for informational purpose only and is not intended to promotion or medical advice. Always seek advice from your healthcare provider regarding of any question you may have about your medical concern, condition, diagnosis, and treatment. Before we get started, I want to take a moment and read through the slides. Healthcare and you. You deserve a quality healthcare. You deserve a quality health information. You deserve to get your question answered. You deserve to make a decision about your health. Self-reflection. What are some example decisions you have made to improve your health? Just like in my participant said, they take a walk, wake up in the morning, get exercise, and some of my friends said they stop drinking coffee, quit smoking, and just to get better sleep and cut down some caffeine. And here are some decisions you can make to improve your health. Eat healthy, exercise regularly, and maintain sleeping routine. And stay hydrated, like drink a lot of water, 8 ounces of water, or quit smoking, or if you do, cut down some smoking and get healthcare check. De-stress. So relax, don't too stress yourself and try to relax. And get healthcare checkup is very important, so always make appointment with your doctor. Healthcare provider, a person that provide a medical care or treatment, also known as doctor, clinic, nurse practitioner, NP, or physician assistant, registered nurse. Healthcare continuum, we will talk about the medical emergency. What is a medical emergency? As some of you might know, and I might already give the answer. First thing, we call 911, right? Here, this is a warning sign for medical emergency. We call 911. If you have this symptom, have difficult breathing, choking, or confused, disoriented, or dizziness, and then have allergic reaction, have difficult speaking, walking, and seeing things. Those are signs of emergency. We call 911. Have a symptom of heart attack or stroke, and suddenly you have a severe pain. Those can be a sign of emergency. What is the first thing you do in a medical emergency? Some of my participants said, oh, I call my mom, I call my dad. We call 911. When you call 911, please stay calm, speak clearly, know your location, answer their question. Then we also you make appointment with your healthcare provider. Before you visit a healthcare provider, write down some list, some information like you might need, and then like what you're taking, what medications you take, and write down a note, jot down some note. So write down some question. And I know when we go to a doctor, I'm guilty of myself. And sometimes you forget, like, oh, what am I going to ask? And some most important thing, and you forgot to ask your provider. That's why it's very important to write down a note. Prepare your list of medication. What are you taking, how much you're taking, and how often you take. Make a list of your personal family history, like your mom, your dad, your grandma, grandpa, what chronic disease they have, so know your family history. Request an interpreter if you need to. For example, like language barrier, you might ask the provider or make appointment before you go see your doctor. Make sure they have a translation or interpreter service provided to help you out. Discuss a health symptom change of any condition, any change, or any progress, or any you need to know, ask your doctor. I know the doctor's always busy when they come in. Ask the nurse, write down the question. Ask how can you prevent your problem and how you can help. Take note, like I mentioned earlier. It's very important, take note. Sometimes we do forget. Write down your phone on your notepad, take it with you. Request an interpreter if you need to, and make sure that you understand everything that's said and done. Sometimes the medical term is get confusing, like language barrier. We might don't understand the medical term. You can ask a doctor or nurse to simplify in a smaller term or simple term. Ask a question. Make sure you understand before you leave the doctor office. If there anyone in your office that speak your language, you can ask them and ask them to write down in your own language, native language, so that way you can go home and refer to it and understand. Do my vitals check okay? Look okay? Ask the question. What can I do to prevent health problem or improve my health? Should I be screening for anything based on my family history? You can ask. Why do I need this test? And sometimes the test can be very helpful. Healthcare screening, preventive tests, early detection. If we do early detection, it can help us with like mammogram, pap smear, colonoscopy. So those screening can be very helpful and save life. We detect early, that can help us. You don't need to get sick to get the screening test. Some screening care may be done in your office, your doctor's office. Why do I need a health screening? Some of these questions are commonly. We don't have to get sick to get the screening check. Identify it early. Health problem, illness early. Treat illness early can be a better help. Reduce risk of developing a serious complication. If we find out a test early, we can take care of it. Chronic health condition. Health condition lasts 1 year or more. Requires ongoing medical attention and sometimes limited daily activity. Like statistics said, 6 out of 10 adults have the chronic disease, and 40% adults have 2 or more chronic conditions. That's why we have this screening to protect it early. Early detection, it saves life. What screening might be person get? Common screening, blood pressure check, heart attack, stroke, cholesterol, heart attack, stroke, blood pressure like diabetic. Which screening do you need? Ask your healthcare provider. Screening may be recommended based on your age, sex, family history, health history, or behavior. The doctor will recommend that to you. Question you may want to ask for your screening. You always ask when and how do I get my result, and always be prepared. Who can you talk to about your result? Like sometimes should I call a nurse, should I ask a lab technician, or should I call a doctor? Make sure you get those information written down so that way you know. Can information be prescribed in my own native language? That is very important. If you don't know how to read or write, ask them, ask interpreter to write down, simplify that in your own native language. What are some barriers getting health screening? Working through common barrier is getting health screening. A barrier and strategy. I don't get sick. I don't feel sick. You don't have to get sick to get a screening. I don't have time. We all do that. I'm guilty of myself. Oh, I don't have time. I don't get sick, and I don't want to get screening. Combine your screening. Like you can combine your mammogram, your pap smear, your high blood pressure. You can do that at once when you make an appointment. I work during clinic hour. Just ask the provider or healthcare provider option. Sometimes they might have it open on after hour or Saturday. Make those appointments. Working through common barrier. I forgot my health screening. And set up a date like for your anniversary, your birthday. Like those tests can be done once a year. It's very important, like mammogram, pap smear. Remind yourself. Write down those dates, those important dates. I don't have a doctor. I don't have a way to get to my appointment. Those can be helpful. So contact with us and call your doctor. Connect with our local resources. We have our resources that we can help. Treatment option. Ask your doctor provider about your treatment option. What is recommended to treatment? What are some expected results? What are the risks? What are the benefits of your test, of your screening test? You can always ask your doctor, ask provider, get those information in your note. Medication is very important. Give your healthcare provider a list of your medication, vitamin, herb, or anything that you take. Talk to your doctor, healthcare provider about possible side effects. Before you take a medication, please read the label, a pharmacist paper, and understand those documents, those labels. Check for the expiration date. Make sure that they still okay to take. And sometimes I know some people say, oh, this is my mom medication. It's okay for me to take. No, it's not okay. Make sure you read the label. It is important to follow the instruction on the medication list. How many you take, how often you take. Sometimes you can take in the morning, it's prescribed there for you, and sometimes take in the afternoon, in the evening, and how often you take. Some of the labels said you take with food, take empty stomach, possible side effect. It might cause you drowsiness. On warning sign, do not operate or heavy machinery. That means including do not drive, do not do anything heavy with objects. Difference between going on emergency room and urgent care and healthcare provider. This is just a statistic and I like to emphasize it. Appointment, emergency room, you don't need to make an appointment. If urgent care, you don't need an appointment. Healthcare provider, yes, you do need to make an appointment with your healthcare provider. Benefit of having health history, emergency room, no, you don't need to write down anything for them. But urgent care, no. But please write down all the family history, your provider, two provider, those are important. Once again, like I mentioned, this is statistic, average cost and average wait time. Emergency room, sometimes we wait for 20 minutes. Urgent care, we can wait for 15 to 60 minutes. Healthcare provider, 18 minutes. Average cost, emergency room might cost you roughly $2,500. Urgent care, $185. Healthcare provider, $165. Once again, like I mentioned it earlier, this is just an average statistic. Trust sources information. Where do you find information on illness that concerns you? Some people will say, oh, I Google it, I go to Facebook, TikTok. Don't rely on social media for health information. Make an appointment with your healthcare provider, primary care doctor. If you do not have a healthcare provider, primary care doctor, we would like to learn more about potential resources. Check out a resources list and the Fact and Not Fair ICT website. And thank you for your time and thank you for being here for our video. And visit our factnotfair.com and scan a QR code for community health session video.